So World Oral Health Day 2023 happened on Monday, but that shouldn't stop us talking about oral health and you know what we should be doing in terms of looking after our mouth. Now the theme for this year is be proud of your mouth. So what is World Oral Health Day's purpose? Well, World Oral Health Day aims to empower people with the knowledge, tools and confidence to secure good oral health. Why is World Oral Health Day important? Well, oral diseases are a major health concern for many countries and negatively impact people throughout their lives. Oral diseases lead to pain and discomfort, social isolation, and loss of self-confidence, and they are often linked to other serious health issues. And yet, there's no reason to suffer. Most oral health conditions are largely preventable and can be treated in their early stages. Now, of course, the interview brought to you by SADA. Now, the vision of SADA is to be recognized as the trusted leader and voice of oral healthcare in Southern Africa. Their mission is to promote the interests and serve the needs of members and, above all, encourage optimal oral healthcare for all South Africans. Now, the South African Dental Association, you can check out their website and learn more. SADA.co.za, www.sada.co.za, and the Young Dentists Council, you can check them out. Their website, YDC, www.sada.co.za/young dentists, young-dentists-council-YDC. Of course, you can find us all on the website, www.sada.co.za, who proudly bring us this interview. So, the question is, who are we talking to today? Well, we're going to be talking to Dr. Nathan Vermaak. Nathan is a general dentist with special interest in implantology, as well as digital and cosmetic dentistry. For the past 5 years, his passion for dentistry and particularly dental technology has driven him to spend countless hours developing these skills to make treatments more predictable and efficient. He's currently in private practice based in Melrose Arch and Rosebank, utilizing his craft to improve oral health as well as mentor younger dentists who practice in the surrounding neighborhoods. Wow, that is an impressive bio. Dr. Nathan Vermaak, welcome. Good to have you here.
Hi, how you doing?
I'm good, and you?
I'm always great, thank you.
Did we leave anything out? Is that accurate?
That's pretty much it. Yeah, that's me in short.
I like what you're doing with in terms of kind of giving back and kind of helping younger dentists. I like that, man. It's important that we kind of look at our future as well, and the youth are our future. So well done at doing that.
Thank you so much. I think that's also part of why I got involved with the YDC as well, because I find that as a profession, you're pretty isolated. So I think giving back to the younger guys and maybe creating more of a community is part of my calling.
I love that. All right, so Dr. Vermaak, let's get into it. What are the most important steps to take for good oral hygiene?
So the simplest thing to actually do is consistency. Right, so when we're thinking about oral hygiene, most of the time people think, brushing in a certain way, flossing a certain number of times a week. At the end of the day, you can be the best brush or flosser in the world, but if you're not consistent, you're probably not going to achieve what you set out to achieve, and that's having impeccable oral hygiene or as close to perfect oral hygiene as possible. Now, I'm not saying that brushing and flossing aren't important. They are what comprises oral hygiene, but the consistency is actually probably the key.
Okay. And what are some of the most common oral health issues that people face?
So basically it can be broken down into two different sections. An issue regarding the tooth and an issue regarding the gum and surrounding tissues. So some of the most common ones we do see, especially in our socioeconomic environment, is holes in teeth, which is very preventable, as well as gum disease such as swollen gums or teeth that feel like they're becoming loose because of gum disease, which is also largely preventable. So caries is the one that affects the hard tissue, and gum illness or periodontitis is the one that affects the soft tissues.
Okay, and what are the benefits of regular dental checkups, and how often should we be going, Dr. Vermaak?
So essentially, that kind of ties into the first two questions as well. So the importance is to make sure that your oral hygiene is doing the job, because essentially we do want patients to come for an annual checkup and for oral hygiene appointments twice a year. So essentially for the rest of the 360 odd days in the year, you're kind of on your own. So the idea of it is to come as regularly as possible, meaning once a year for a general checkup, twice for oral hygiene appointments, so that you can make sure that everything is as it should be, and where there could be improvements, that you can make such improvements. So you can pick up things that are small holes very early on, so it's a small filling, as opposed to a root canal treatment, which involves the nerve or extraction, which involves removing the whole tooth. With regards to the soft tissue, if you catch gum disease in the very early stages, it's very treatable and can prevent progression quite easily. So the benefits of doing the checkups is essentially just to make sure that we are able to keep our teeth for as long as possible, as we are also living a lot longer than we were a couple generations ago. So we need our teeth to eat, to get nutrients, and to keep the rest of our body nice and healthy.
Thank you for choosing Clicks. If you have just joined us, Stephen Taylor with you, chatting to Dr. Nathan Vermaak, all in conjunction with World Oral Health Day and, of course, World Oral Health Month. The theme for this year, be proud of your mouth. Dr. Vermaak, what risks are associated with poor oral health?
So essentially the mouth is the gateway to the entire body, our GIT, our gastrointestinal tract, as well as it's a gateway so we can see many things that could be potentially wrong in the body. So, for example, there's a plethora of things that could be associated with poor oral health. But one thing that has been drawn more into the limelight in the most recent years is essentially gum disease and how it affects our general well-being, from our heart to digestion, as well as sexual organs such as erectile dysfunction.
Wow. From what? From not brushing your teeth, really?
So essentially they are starting to link some periodontal conditions to having an increase in your actual ability for penile erection, essentially. So erectile dysfunction is definitely being seen more regularly in especially first world countries, where the shift is shifting from tooth-borne diseases like holes to more towards gum disease. So a lot of the first world countries, we are actually seeing a lot more links, especially to cardiac and as far down as it can be with your sexual drive, essentially. Wow,
that's very interesting to know. So how do people prevent tooth decay and cavities from forming?
So good oral hygiene is a very, very, very good start. But more importantly, to a large degree, is you can be brushing very well, cleaning, flossing very well, going through the checkups, but your diet as well as your general well-being can also play a role in actual cavity formation.
Yeah.
So if you have a high acidic diet, lots of soft drinks, lots of sugar, lots of sweets, and lots of sour sweets, all of these, what they can essentially do is they can help the bacteria that's always present in your mouth. No matter how good your oral hygiene is, you'll always have bacteria. What it does is it acts as a fuel for these so they can grow their bacterial colonies and grow in size. What they also do is they make a subproduct, these bacteria, which is essentially like their form of defecating or pooing, which is an acid. So the acid is excreted from the bacteria, and that is essentially what causes cavities. So one of the simplest ways to prevent it is to have a much healthier diet. If you can afford to go to a dietitian to get a good diet planned out for you, as well as to limit the amount of fermentable carbohydrates such as sugars.
All right, Dr. Vermaak, how does age affect one's oral health?
So age is an interesting one, and as we are entering a new realm where people are living a lot longer on average, as well as when they're living longer, they're keeping their teeth for longer, as we're seeing there being a less of a need for dentures overall as a worldwide society as we progress into more preventative measures.
Wow.
So one of the things we do see with age is ability to clean, because we lose the ability to use our hands as well as we were when we were younger.
Yes.
So that directly affects our ability to clean. And largely, even if we have kept our teeth for longer, with tooth loss, diet becomes a problem. So then we eat easier to chew and digest, which is often fermentable carbs, which has then another snowball effect on the remainder of the teeth, which can also negatively affect oral health. Another thing age does do is, because even though enamel, the substance on our teeth that coats and gives that shiny white color, even though it's the strongest substance in our body, it is also prone to wear. So if we are keeping our teeth for a decade or two longer, we are subject to more wear and essentially a decrease in oral health over a long time, especially if we're not looking after that enamel efficiently.
Wow. So what are the most common causes of gum disease?
So gum disease, generally, it's access to cleaning. So essentially what I mean by access is one of the main causes that we see on a day-to-day basis. And I think often it's a joke that your dentist says, oh, you must floss. Oh, when was the last time you flossed? Oh, you were there. And so I think one of the main causes is access to in between the teeth to be able to clean whatever debris is stuck in between the teeth, which can affect the gums. So that is probably one of the most common causes, which is very easily avoided by the use of floss. So with doing so, you can then prevent the gums from getting inflamed, infected, and affect the surrounding tissues. Another most common, one of the very big common causes is yet again, is diet, as well as your general well-being. If you have, for example, vitamin deficiencies, vitamin C, for example, you can get very weak gums that slop and bleed a lot and are very inflamed. So there's many effects, but most of it links to diet as well as ability to clean, and there is also some genetic links which you can inherit from your parents.
So simply brushing your teeth without flossing is a no-no. We should be flossing as well.
So essentially, if you're going to be brushing alone, you're missing potentially up to 40% of the teeth, depending how close your teeth are to one another, if there's no spaces. So essentially, you're only brushing just over half of your mouth by only brushing and not flossing.
Sure. Okay, I learned something there. Very interesting. Okay, Dr. Vermaak, tell us, any closing thoughts from yourself, and how can our listeners contact you if they want to?
So if you have any questions or concerns about oral health, there is a bunch of content that can help you. You know, one of the problems I do face here, it's not the willingness or the ability to clean teeth, it's the access to the knowledge, because it's not as commonly taught in our schools, as well as not something you really talk about amongst peers.
Yes.
So there's a whole lot of actual content on the worldoralhealthday.org website, where you can get quite a bit of information about oral hygiene, dental health, as well as how to look after your teeth. Okay. There's also many videos on YouTube. If you'd like to get hold of me, the most simple way is to reach out on Instagram at NV Dentistry. Is my handle on Instagram, so it's just at NV Dentistry.
So how do you? Oh, so it's N as in NV as in your name, Nathan Vermaak.
That's correct.
So it's NV Dentistry. Is that just it, right? NV Dentistry on Instagram. Okay. All right. No, Dr. Nathan Vermaak, thank you for your time. You seem to know what you're talking about, man. I learned a lot from you. So thank you very much for taking the time and having a chat to us. I really do appreciate it. And keep up the good work that you are doing.
Thank you so much. I appreciate it.
Thank you. Have a good one. Keep well.
You too.
Thanks. Bye-bye.